Hi, my name is Olga, and today I'm going to talk about anxiety, what it is, its signs, symptoms, and treatment. You might be asking, what is anxiety? Well, anxiety is the body's natural response to danger, an automatic alarm that goes off when you feel threatened, under pressure, or are facing a stressful situation. The most common characteristic of anxiety is a fear that is constant and overwhelming. It interferes with your relationships and activities and stops being functional. Anxiety sufferers present two types of symptoms, emotional and physical. The emotional symptoms are irrational and excessive fear and worry, feelings of apprehension or dread, watching for signs of danger, anticipating the worst, restlessness, trouble concentrating, feeling tense and jumpy or irritable, and feeling like your mind's gone blank. The physical symptoms are pounding heart, sweating, headaches, stomach upset or dizziness, frequent urination or diarrhea, shortness of breath, muscle tension, tremors and twitches, and fatigue or insomnia. There are several ways that people can help themselves to manage anxiety naturally, like connecting with others by joining a support group, practice relaxation techniques like breathing exercises or progressive muscle relaxation, exercising regularly 3 to 4 times a week, getting enough sleep, preferably 8 to 10 hours, avoiding caffeine, alcohol, and nicotine, and training your brain to stay calm with either yoga or meditation. There are two types of therapy that psychologists use to help patients with anxiety. There's the cognitive behavioral therapy and the exposure therapy. The cognitive behavioral therapy focuses on thoughts or cognitions in addition to behaviors. It helps you identify and challenge negative thinking patterns and irrational beliefs that fuel your anxiety. The exposure therapy encourages you to confront your fears in a safe, controlled environment. Through repeated exposures to the fear of situation, either in your imagination or in reality, you gain a greater sense of control. As you face your fear without being harmed, your anxiety gradually diminishes. If your anxiety is severe enough to interfere with your ability to function, there are many medications in the market that help you control and manage the symptoms so you can return to your normal daily life activities. Some of them are Lexapro, Xanax, Zoloft, Paxil, Effexor, Klonopin, or Wellbutrin. Anxiety has short-term and long-term effects in your body. In the short term, in the brain, the hypothalamic pituitary adrenal, or HPA system is activated. The HPA system triggers the production and release of glucocorticoids, including the primary stress hormone cortisol. The HPA system also releases certain neurotransmitters called catecholamines, particularly those known as dopamine, norepinephrine, and epinephrine. Catecholamines activate an area inside the brain called the amygdala, which appears to trigger an emotional response to a stressful event. In the case of anxiety, this emotion is most likely fear. The brain releases neuropeptide S, a small protein that modulates stress by decreasing sleep and increasing alertness and a sense of anxiety. This gives the person a sense of urgency to run away from the situation, and this is what most people know as the fight or flight. In the heart, lungs, and circulation, as the anxiety arises, the heart rate and blood pressure increase instantaneously. Breathing becomes rapid, and the lungs take in more oxygen. The spleen discharges red and white blood cells, allowing the blood to transport more oxygen throughout the body. blood flow may actually increase 300 to 400%, priming the muscles, lungs, and brain for added demands. In the immune system, the steroid hormones reduce activity in parts of it, so that specific infection fighters, including important white blood cells or other immune molecules that can be repositioned. These immune-boosting troops are sent to the body's front lines where injury or infection is most likely to happen, such as in the skin and the lymph nodes. In the mouth and throat, as the fever rises, fluids are diverted from non-essential locations, and that includes the mouth. This causes dryness and difficulty talking. Also, in addition, stress can cause spasms of the throat muscles, making it difficult to swallow. In the skin, the stress effect moves blood flow away from the skin to support the heart and muscle tissues. The physical effect is cool, clammy, sweaty skin. The scalp also tightens so that the hair seems to stand up. In the digestive system, stress shuts down digestive activity, a non-essential body function during short-term periods of hard physical work or crisis. In the long term, your body never gets the signal to return to normal functioning. That can weaken your immune system, leaving you vulnerable to viral infections. In the long term, anxiety has an effect on the immune system. Stress hormones impact the development and severity of many different diseases and bodily systems. In some cases, stress causes existing conditions to worsen. In other cases, stress seems to be a major factor creating vulnerability to developing new conditions. The chronic stress that comes with severe anxiety leads to various common medical problems. It affects the cardiovascular system, digestive system, musculoskeletal system, and reproductive system. It also can cause or worsen many skin conditions and affect your overall health. Anxiety is a normal human emotion. While it normally serves as a beneficial and adaptive purpose, anxiety can also become the cause of tremendous suffering for millions of people. The future remains optimistic for those of us who struggle with anxiety every day. We are confident that advancements in the treatment of anxiety disorders will continue to bring hope and relief to the people and families affected by these disorders.